Have you ever felt that nagging pain that just won't go away, whether it's in your knee, back, or some joint, and thought, an anti-inflammatory will fix it? It's a very common reaction, isn't it? But is that always the best solution, especially for us who are over 65? Many people use these medicines without knowing the risks, and that's exactly what we're going to talk about today. I want to help you understand when anti-inflammatories can be your allies, and more importantly, when they can cause more problems than solutions. If you've ever found yourself thinking about this or know someone who uses these medications frequently, go ahead and subscribe to the channel and hit that notification bell. That way you won't miss any tips that could make all the difference in your health and well-being. So, let's dive in. Anti-inflammatories are like a double-edged sword. On one hand, they are powerful for relieving pain and reducing inflammation, which is our body's response to an injury or irritation. Think, for example, of a sprained ankle, swelling after a strenuous effort, or even a flare-up of back pain. In these moments, an anti-inflammatory, used wisely and for a short time, can be a real relief. It helps to lessen acute pain, that sharp, sudden pain, and also swelling, allowing you to move better and recover. But here comes the but, and it's very important for us. As we age, our bodies change. Our kidneys, our liver, and even our stomach become more sensitive. And that's where the frequent or unsupervised use of anti-inflammatories can become a serious problem. Perhaps you're thinking, but I've always taken them and never had any issues. And it's true, many people use them for years without immediate symptoms. But the risks accumulate. One of the biggest dangers is for our stomach. Anti-inflammatories can irritate the stomach lining, causing gastritis, ulcers, and even bleeding. Imagine that burning sensation, severe heartburn, or even a persistent ache. These could be signs that your stomach is suffering. Another point of concern is our kidneys. They're like filters for our body, and anti-inflammatories can overload them, reducing their ability to function properly. For those who already have kidney problems, even minor ones they might not be aware of, using these medications can significantly worsen the situation. And we can't forget about the heart and blood pressure. Some studies show that prolonged use of certain anti-inflammatories can increase the risk of heart problems in high blood pressure, which is already a concern for many of us. So, when do they help? They help in specific situations of acute pain and intense inflammation, always under a doctor's guidance. For example, if you fell and sprained your foot, or if you have a very severe toothache, your doctor might prescribe an anti-inflammatory for a few days to ease the suffering. In these cases, the benefit of reducing pain and inflammation outweighs the risks, as long as the use is short-term and supervised. And when do they cause harm? They cause harm when used on your own for too long, in incorrect doses, or when you already have other health conditions, such as kidney problems, heart issues, high blood pressure, or a history of ulcers. It's common to think that if it's sold over the counter, it must be safe, but that's a dangerous idea, especially for us. The good news is there are many other ways to manage pain and inflammation without relying solely on anti-inflammatories. For example, hot or cold compresses can work wonders for muscle and joint pain. Physical therapy, with specific exercises and stretches, strengthens the body and reduces inflammation naturally. A healthy diet, rich in fruits, vegetables, and omega-3s, also has incredible anti-inflammatory power. And we can't forget the importance of maintaining a healthy weight and staying active, even if it's just a light walk every day. The main message is, do not self-medicate with anti-inflammatories. If the pain persists, if it's very severe, or if you have any doubts, talk to your doctor. They are the right person to evaluate your case, understand your health conditions, and recommend the safest and most effective treatment for you. Sometimes a simple pain reliever, like acetaminophen, Tylenol, can be sufficient and much safer. Small changes in seeking professional guidance can make a big difference in your quality of life, relieving pain without putting your health at risk. Remember, taking care of yourself is an act of kindness and wisdom. If this video helped you understand a little more about anti-inflammatories, please give it a like and share it with someone you care about. And tell me in the comments, have you had any experiences with anti-inflammatories? What's your biggest question about the topic? Your participation is very important to us. A warm hug and see you next time.